Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Yeah, I'm Dr. Gupta. I'm practicing neurologist from Meerut, and I just want to add that epilepsy is a neurological disorder, and just like disorders, other diseases, epilepsy is also very well treatable. Nothing to be afraid of.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
In seizure, that body is controlled by the brain signals from the brain. When these electrical signals get out of control and they get synchronized, and they produce uh, uns- uncontrolled synchronized brain electrical activity, so that causes a person to have a seizure.
What is epilepsy?
Just one seizure is not an epilepsy. It can be in many circumstances you just have a seizure, but we would not call that epilepsy. For someone to have epilepsy, it is a tendency to have recurrent seizures. So it may be because of sudden alteration in the brain structure, some lesion in the brain, some neurosynaptic malfunctions, and so forth. So it's basically a tendency to have recurrent seizures.
What are the different types of seizures and do they affect people differently?
Yes, seizures have a profound effect on one person, on a on an individual, and they have a very bad effect on the person's socioeconomic life and his functionality and his cognitive abilities, ability to understand things, do things. So definitely he should not be having any seizure any time of life, and continuous seizure really hampers the life. So seizures can be as little as just lack of responsiveness for a few seconds or minute, and it can be as dramatic as we all know the generalized tonic-clonic, where the person is unconscious, frothing from mouth, and there is twisting in of the limbs, jerking of the limbs.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Yes, by and large, epilepsy is a very defined disease disorder, and a clinician can make out whether the epilepsy is because of some structural abnormalities in the brain. For example, you must be aware of neurocystic psychosis in the brain, the worm in the brain causing seizures, the worm that we get from eating cabbage, and tuberculosis in the brain tumor. All those are structural lesions. If the person has a trauma and injury to the brain, or it could be some intrinsic problem in the brain structure itself. You will not be seeing in your MRI. So there is some different channelopathies, we call them channelopathies, abnormality in the transmissions, neurotransmissions, which cause. So an experienced neurologist can identify all of them, and then he can he can determine the course of treatment for that person.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
See, anytime there is difference in the activity of the person, like I told you, like just the other day, the parent brought a child with very few seconds of child complains vertigo, is not able to stand, and he was not responsive for some time. And let me tell you that in many of the patients, the investigations may not reveal anything. And the other things may be like the uh, parents bring the children like that, they are kind of in daydreaming state, on and off. They become like they're doing some work and they become off and they just sit and stare for a few seconds. So probably they're having an experiencing an absence seizure. And then they can be having jerk. Then they can be having generalized tonic-clonic seizures, I told you that the most dramatic ones we know of.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yeah, epilepsy, just I told in the beginning that it is a disorder, medical disorder, which if we treat by and large, it will be they will be as good as normal. So this we need to everybody needs to understand. The problem is that they see that a whole season and its dramatic appearance, so they get frightened. So there is a stigma with it. But by and large, majority of the patients do extremely well with the proper treatment. And let me add that some of the celebrities and some of the very successful people have been patients of epilepsy and they have taken their treatment. They're doing as good as and better than the very normal people. Also, issues of people of manageable age, and I think the parents should be very upcoming and they should share it, and we should be all very understanding. We society has to really come up with this thing and really uh, they should not be seclusion of these people.
How does this stigma affect people with epilepsy?
Yeah, like I told about the marriageable girls or marriageable age support. So it should not be hidden. The disease should not be hidden, and it should be shared. I feel so that the treatment is continued. And if the treatment is continued, then there are anti-epileptic drugs which can help them to have a normal life, to conceive, to have baby, to breastfeed a baby. So there is absolutely no problem, and there is like people can have their normal work except for certain restrictions like driving and all for certain period of time, or maybe in some certain hazardous occupation where epilepsy can jeopardize their life, put their life at risk. So I would suggest that there should be no stigma, either in socially if you think of or you think of from the occupation profession point of view.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
The most common triggers would be the lack of sleep. They should have a proper sleep hygiene and proper sleep. They should go to bed proper time and do not try to wake up very early. So lack of sleep is a big trigger for all the seizures and the entire spectrum of epilepsy. Then improper timing of their food meals should be on the proper time. They should have a very normal lifestyle and a very I usually what I tell my parents, they should have a schedule and they stick to it, and they should be the life should be very stress free. Other thing is that they should not indulge in alcohol, smoking, or drugs like that. I would not suggest. I would not definitely not recommend that. That was one trigger for epilepsy. Those are the things. And definitely, then if they are treatment, they should not miss the doses. So missing doses is a very big problem for the treating neurologist because they come back uh, with the seizure, and then it's more of like a snake and ladder. You reach where you had started.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Yes, definitely there are precautions on driving. Driving should not be undertaken while on help those suffering epilepsy and those on anti-epileptic drugs, because certain anti-epileptic drugs they by themselves have some problem in their perception and their judgment. Not exactly, not too much, but might have certain drugs those given for difficult to treat epilepsies. That is one thing, and they should be stay away, should not be alone at heights, near fire, near very dangerous equipment like machines, sharp tools.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yes, of course, during seizure, you should first of all make sure the patient is not in a place of dangers. For example, just I mentioned fire or height. or near sharp object, you should remove take the patient away from that place, and then place the person in the side left side facing left side, uh, and people start doing putting things in the object, or they try to open the mouth. These are very wrong things, and they should be very hazardous. They can injure the patient and cause more of harm than any good to the person's having a seizure episode. And if at all the seizure doesn't subside or person is they should immediately take the person to a nearby local physician for care.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
And final thought, may I add one shairi? All I think is that you should accept the disease. You know, we should not try to run away from the disease. We should accept it. Once we accept it, then we will for sure follow all the treatment, and by and large we will be functional. We will be relatively disease free. And to that, I would like to add, हर किसी को मुकम्मल जहां नहीं मिलता, किसी को जमीन, किसी को आसमान नहीं मिलता. So somewhere we are in between, and we have to really have a good treatment so that we have an absolutely or near normal life. So there's nothing to worry about.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.